Welcome, everybody. Hello, we'll give you a few moments to connect to audio. We welcome you to turn your videos on if you're in a place where you can. If you can't, that's okay too. I know it's evening time and lots of times at this time of day, there's things happening in the background that you may want to block out. That's okay. But thank you so much for joining us. So I recognize, so we have some current students, alums on the call, and prospective student. Abby, it's nice to see your name on there. I was just telling our presenters and joiners that you're looking at the IC program and that we chatted yesterday, and hope that you'll join us in the fall of 23, which would be great. So I'm glad you were able to join. It's so nice to see everybody. Becca Worm is up in Canada. Always love that. So, okay, I was trying to stall a little bit while more people were coming in on the waiting room, but let's go ahead and officially get started. So I'm Julie Dorsey. I'm the current chair of the Occupational Therapy Program. I'm also a really proud alum. I was in the third graduating class of our ICOT program. Did my bachelor's and master's here, and it's my real honor to get to chair the program. Never in my wildest dreams did I think that was going to happen, but here I am, and so grateful. And this alumni speaker series is just, one of the highlights of my job, of getting to connect with alums. You see how excited I am to see alums and get to hear from them and hear their innovative practice and what they're doing, and seeing how proud they make us and what an impact they're making on their clients' lives. And to connect them with our current students and help them to network and, again, just learn more about practice and practice opportunities, because there's only so much we can pack into our curriculum. And a lot of what our alums are doing, there's more advanced practice. So it's a great opportunity for our current students to learn about, these really innovative areas. The idea really was sort of born from the vision of Julie and Emma, who are on our screens. They are current seniors, but in their junior year, they started getting really excited about thinking about, what are some additional practice areas and innovative types of work, and how can we learn more about this? So they brought that question and comment to Jenna Heffron, and then they came to me and sort of married this idea with, again, my deep feelings towards wanting to connect with alums. And it was in the pandemic. So at a time when we're all feeling really disconnected and looking for ways to come together and come together in different ways. So that birthed the series, and we started in January 2021. We had one session every week in the spring semester last year, which is super intense. We had 17 speakers over 15 weeks on a huge variety of topics. And just the way our alums showed up in such a short period of time was unreal. And it shows, the depth of our community, and how much people wanted to, again, find ways to connect. So silver lining of these COVID times, now we can Zoom our friends in from Canada, right? And we have friends and alums who have joined us from Taiwan. Zue comes from Taiwan sometimes, and all over the US, which is really amazing. So, tonight we're going to be hearing from Taryn, who has deep roots at IC. You're going to get her official bio from Julia, who is facilitating this evening. So you'll hear more about her, but Taryn did come back and teach for us for a year, which was amazing. So after she graduated, and we miss her, and there's always a home for you here, Taryn, if you want to come back. So I'm so thrilled that she's joining us tonight, and you get to learn about what she's doing. So without further ado, let me turn it over to Julia, who will talk about accessibility and access for tonight's session, and introduce Taryn, and then we'll get on to our main event. So thank you everybody for coming. It's great to see you.
Awesome. Thank you, Julie. Hi, everyone. So glad you all could make it tonight. It's so lovely to see all your faces and names. So before we get started, we'll just start off with some access info. So talking about the Zoom closed captioning and live transcript, you will click on CC live transcript at the bottom of your Zoom window, which should be next to the reactions button. And then you have two options. The first option is show subtitle, and that will make captioning appear at the bottom of your screen. And to turn off closed captions, you click on CC live transcript again, and then hide subtitle. The second option is to view full transcript, and clicking that will make the live transcript appear on the side of the Zoom window. If you want to simultaneously view the full transcript and the chat feature, go to the top of the live transcript window and click on the downward facing caret, aka Karen, and then pop out. You can then move the live transcript anywhere on your screen. For the chat feature, the chat is at the bottom of the Zoom window next to the participants button. Similar to the live transcript, if you click on the chat button and then the caret at the top of the chat window, you can choose to pop out the chat and move it around your screen. We welcome you to use the chat feature throughout the presentation, and during the question and answer period, we will be fielding questions from the audience through video, audio, and the chat. So just engage with the technology in whatever way feels best to you. This session will be recorded along with an edited full transcript and will be posted to the virtual OT site for current students, faculty, and staff. And if anyone like alumni or anyone who's not current students, faculty, and staff want to access the recording, just let us know and we will figure a way to get it to you. So tonight is our 5th speaker series of the spring semester, woohoo, and we have the pleasure of hearing from our alumni, Taryn Rosner. So Taryn Rosner is the Director of Therapy at MOCO Movement Center, an interdisciplinary pediatric outpatient clinic in Kensington, Maryland. Dr. Rosner has been a practicing occupational therapist for over a decade with experience in inpatient rehabilitation and outpatient pediatric practice. She has also taught for 1 year in the ICOT program. Her specialties include neurodiversity affirming care, sensory motor development, and neurological rehabilitation. Our speaker will start us off with an overview of their work and experiences, which will be followed by a question and answer period where the audience will have a chance to chat directly with Taryn and ask any questions you might have. We envision this as informal conversation and an opportunity to engage with our fabulous alumni. So without further ado, I will turn it over to you, Taryn, to get us started.
Thank you. I'm so happy to be here. And I know it's very informal, but I am going to put up a PowerPoint because I feel like so much of what we do at MOCO is very visual. And I am very visual, so I like to have it for myself. I'm just going to stick that up. So at MOCO, we have sort of developed our own model, and we're a pediatric outpatient center. But we really embrace this model that we like to call the applied functional therapy model because we weren't very creative when we made it up, the name, but we still call it that. And it's a really unique interdisciplinary model that connects us with the community and that really puts function first. So I thought that the ICOT community would really appreciate this model. It's really kind of everything that I thought OT would be when I went out to the world and didn't always find, but then found when I came home to MOCO. So I love this picture on the right to start us off. This is a speech therapist and a child of ours that's on the wall at the climbing gym. So we'll come back to all of those fun spaces. So I just want to give you kind of a background about MOCO and our belief system and sort of the assumptions that we make as a practice, because I think it informs kind of the rest of what we do. We are really, really dedicated to following the neurodiversity movement and outside an umbrella of that, really being tuned in to being respectful and culturally aware in lots and lots of ways. So we really value diversity, and we are really explicit about valuing neurodiversity, especially in the pediatric world. We feel like that's really important to be explicit about. We value autonomy, and we value autonomy over independence. So making sure that we are always listening to and supporting our clients to do what they want to do, whether they're able to do that by themselves physically or not. The interdisciplinary model really allows us to be holistic, which I'll talk a lot about later, but we believe that understanding all of the body systems at the same time is important, and we work really hard not to have silos in our care between our disciplines. And we believe that everyone has the right to access their community in the way that they find meaningful. And so that when we talk about like our community partnerships, that's really how we found avenues in to provide access to some of our kids who were really having a hard time accessing meaningful community spaces. And then we believe that skills should not be clinic bound. So one of the things that many of us at MOCO had sort of found in our other settings is that there was a lot of focus on really impairment-based or sort of splinter skill development, and that then the child would walk out the gym door and not really know what to do with those skills. So our leader, Andrea, who owns the clinic, used to say, she's like, we're working on the weight shift, but like the weight shift for what? And so we really like take that to heart. It's like, what is this for? Where are they going with this skill? And then we took it to the next step and we said, well, if that's where they're going with the skill, why aren't we there already? And so that's kind of where the model came from. So these are kind of our big picture pieces that we really focus on. Sorry, this presentation is also for like other groups, so I'm going to be less formal about it and move through, but I'm happy to like stop anywhere. So just either stick a hand up or turn on your mic anytime if you want me to slow down on anything. So autonomy centered, we differentiate ourselves from child-led because we feel like that gets used in a lot of different ways out in the community, but we really focus on being autonomy centered. So we're a partnership with the child and with the family, and we make sure that the first thing that we're keying into is what the child's goals are for themselves. And if the child's not yet able to communicate those to us really, really clearly, then we bring the family and the people who know the child best in to help make sure that we're understanding and honoring what it is they want to do. And in that, we're really explicit about not using any behavioral interventions. And so we don't use any extrinsic reward systems, no withholding, nothing, no planned ignoring, none of the behavioral techniques. We're really, really focused on autonomy-focused care, and we prioritize all types of communication so that we can really understand what that person is striving to do. Our interdisciplinary model is really focused on us learning from each other. So I'm going to show you a tour of the gym in a few minutes. We have like a virtual tour. I wish I was there tonight so I could take you around, but the virtual tour is very cool. And it's a very open space. And so when someone is treating, there's one hidden room for kids that really, really need it, or if we have to do ADLs. But for the most part, we're all in the same space. And so when I am treating my kid who comes on Monday, if they see speech on Wednesday, we're right next to each other during those sessions. So I can always see, even if it's not an official co-treat, we are always seeing each other treat. We're always borrowing ideas from each other, and it makes our sessions from the outside look very similar. It can be hard to pick apart what therapy a child is receiving at any given day. And it allows us to really, truly step into that interdisciplinary space. So our team is made up of speech language pathology, occupational therapy, physical therapy, and movement coaches or aides. And so the movement coach piece of our team is really interesting, and that's kind of a different part. They're not traditional rehab aides where they sort of take a list of activities or do the preparatory activities. They're integrated into the session, and all of our aides are either current college students or students that are between their undergrad and grad year, and they're all going into therapeutic professions. So it's a teaching facility in that way. We bring them on to learn and to get ready for school and also be aides with us. And it serves as a sort of a near peer relationship for our kids too. So all of us therapists get to a certain point where we're just not very exciting anymore. And the near peer relationship is really cool. And when we recruit our aides, we recruit aides that have movement expertise in lots of different areas. So we recruit climbers, skaters, runners, sports people, like people who have something to bring, musicians, who have sort of a skill that they can connect with a child's interest. And we really try to match up those relationships. So they're a really important part of our team. And we used to have behavioral health, and we would love to have that again. We had a social worker who specialized in mental health support. And so we would love to have that again in the future. We're a relationship-based model. We really believe that the relationship between the child, the therapist, the aide, and whoever is on that team has to come before anything else. And with that we all have to be able to co-regulate. And then function without gatekeeping. This is the exciting part, so that's what I'm kind of going through. So we don't think that you should have to earn the right to participate in an activity by achieving a set of skills before you step into that activity. So I love this picture because this is a child who has not yet mastered balance, and he's too big for a traditional bike that has training wheels. And so he was not really interested in learning the balance piece. He just wanted to move and get on the go. And so we built him some external training wheels. And this is Charles, one of our movement aides, who is one of our biking experts. So really, when we think about function without gatekeeping, we think about safety as being the only prerequisite for participation. And that's not to say that a child has to get to a certain skill level, but just that we need to make sure that the activity or the environment is modified in order to allow them to participate. And so in that, we embrace both skill development and adaptive or compensatory strategies, just to make sure that we're maximizing the participation. And these are our community connections. So the reason that we want the community connections that we have permanent connections where we can really take kids long-term for short periods of time during the week, so that they can really build safety and familiarity in the community. That's really important for a lot of our kids who have either mental health and emotional barriers to participation, or who may have intellectual barriers where they need to really learn the routine or the accommodations that are available in a place before they feel comfortable there. We have seasonal places that we participate with, especially like the ice skating rinks and the outdoor places where we can kind of give kids a taste, or families a taste, of how to use that space, and then leave them to access the space again on their own. And then we have occasional one-time or periodic partnerships that are based on a particular kid's interest. So if we have somebody that comes up with an interest where we haven't had a partnership before, then we'll go out and look in the community and see if there's a partnership that we can form that'll foster that interest. So this is a picture here of our one of our speech therapists leading talk yoga. And if you look really carefully, that's Emily Grossi. If anyone knows her. We have one other IC alum on our staff. She came as a student and never left. And so this is a group setting. We've got 3 or 4 kids that are involved in this outdoor yoga class, working on articulation, voicing, and body control in a group yoga class. So here, I'm going to take you on the tour. So this is MOCO. This is our home gym. So when we're not in the community, this is where we are. And so we know that not everybody can get to the community right away because of either the hours of the availability of the space, or just because the family is not ready to take that step. And so we try to make our gym also look like it doesn't really look like anywhere else, but it has all the elements that you will find in other community spaces. So if you see, as we enter here, this is our half wall, because we don't ever want the families to be shut out of therapy. In a lot of places, we know that the child has to disappear and the family has to stay somewhere else. But until COVID, we really welcomed like siblings to be in the gym, to join one of our movement classes, to be close by, and parents and other family members to really watch and participate in what's going on. So we've got basketball hoops of all size, sort of the older kid workout area, monkey bars, and then we have 3 major obstacle courses that we change every week. So you'll see on the left here, we've got the big obstacle course. Again, we are not the best at naming things. We're really fun in every other way. So the big obstacle course is like a nonlinear playscape. So it changes every 2 weeks. It's where we tend to get most of our height. And we try to build it so that skills that you see on playgrounds or parkour gyms or like community spaces that would be for climbing structures would be. So we have tunnels. We often have spaces where you have to go down into a tube or come back up. Ladders, suspended monkey bars, all of these points on the ceiling can suspend equipment. So we'll put things up there. This is a pulley system here to open the top of one piece of the obstacle course. So lots of different pieces. Sometimes I'm not sure exactly how this thing moves. So you can see kind of from another space, we've got the ropes that you see in gym class. So we try to pick our equipment based on what you're going to see other places. So almost none of our equipment is from therapy catalogs. It's all from gymnastics gyms or PE stuff, or from like a specific sport. So we've got some boxing and BJJ equipment over here. And so we try to always have equipment that's going to look familiar if a kid goes from us to another setting. The reason we picked things like the ice, the rock walls, and the gymnastics gym as our core equipment is because it just happens that in Montgomery County where we are, those seem to be like the hot ticket social items. Like people have the skating birthday or the birthday party at Earth Treks. And they seem to be, other than sort of the traditional basketball, soccer, outdoor sports, they just seem to be kind of the gathering spots. So they're the high interest ones. This is our synthetic ice rink back here. You can see our climbing wall. This is our rappelling wall. So for kids who are feeling intimidated by Earth Treks and want to try it here first, this is like a nice first try. These are our other two smaller obstacle courses. This is our gymnastics balance beam slack line, like you would see outdoors at a lot of the parks around here. They'll have permanent slack lines put up. And it's just like a very popular backyard item. So for play dates and things like that, the slack line is a nice piece of equipment to be familiar with. And these are the parallel bars that are used really frequently in the gymnastics classes near us. We have a gymnastics coach that comes in to train all of our staff on spotting and skill development too when they start with us. And then, sorry, I hope I'm not making anybody dizzy with how I'm moving this. This is the tumble track, which is a gymnastics grade, like linear trampoline, basically. And if we come back over our pillow pit, lots of opportunities. This is Cosmo. He's our wrestling dummy. He weighs 50 pounds, so he's great for heavy work, but he's also great if you have kids who are working on martial arts. He's a really good static person to practice your wrestling and BJJ moves on. We have a full-size trampoline, and then this is a tread rock climbing wall, so it moves as you climb. So if we're working on endurance, for a kid who's not ready to like commit to a whole hour at Earth Treks or a whole 45 minutes of speech there, they can work on this and it tilts back and forth so you can get whatever angle you're working on. So if somebody's one day a week at Earth Treks and one day a week at the home gym, and they're really trying to get that 5'11" where they need to be tipped back and get over the bulge, we can practice that by tipping the wall back for them. And then, sorry, I wish this turned just a little easier. We have lots of baby stuff too for our little guys that come in. And then this is the last sort of fun, exciting part. This is our music area. You can see all our bikes over there for going outdoors. So this is an electronic drum set. This is an Orff xylophone. This is what they use in a lot of the elementary school classrooms. So these are instruments that a lot of our kids experience when they push in for specials. And we find that in the inclusion programs near us, most often if a kid is starting to move from a fully segregated classroom to an inclusion program, then the first things they push into are music and art. And so this is kind of the first set of equipment that some of our kids experience when they're experiencing the whole gen ed classroom. So we like to help them be familiar with that. And then everything is set up. I'm married to a band teacher, so everything is set up in the same color system. And then when we want songs, we get to request them and get them printed out in color-coded music for us. So I've got the in. So that is the MOCO tour. And then we also have, when we're out of the gym, so these are just additional pictures I'm going to go through as I'm talking, of kids using the equipment. We then transition to community sites that use a lot of these skills or a lot of these pieces of equipment. I love that picture of him. I've been working with him for 7 years. The music area. And so I forgot this was near. So this is just a peek at sort of the interdisciplinary nature of the care. So I'm going to play this for you guys and tell me if you can hear it because I forgot to check when I reshared. Perfect.
Faster. Like faster than last time? Medium. Oh, that's how fast. You want the medium fast. Okay, here we go. And how many frogs, Ken? Three disco frogs. All right, ready, set, and 3 little disco frogs sat on a speckled log, eating the most delicious fun. Yum, yum. One jumped into the pool where it was nice and cool, and then there were 2 disco frogs.
So I wish you could see his face because he was just like giggling uncontrollably. This was just the other day. So on the right here, you have a speech therapist, and this is me. And so I was in the gym with this child. I don't have an aide with him because I just moved his time. And so we were doing our thing, and Stephanie just happened not to have a kid at this time. And so because we're all in the same space and because we all feel really comfortable with each other, she just stepped right in, and we got to do this beautiful language production. He's working on, he loves music, and I have no idea where this Disco Frog song came from. He's obsessed with Jimmy Fallon. So at one point when we said, "Where are you jumping?" He said, "Into the Jimmy Fallon." I have no idea. So if Disco Frogs is from Jimmy Fallon and somebody knows, let me know. But so this is just was a beautiful moment. He knows both of us. We were able to step in, and all of a sudden he was talking voice production that was really audible. We were so loud. The whole gym had this song stuck in their head for the rest of the night. And he's getting this like beautiful jump and land. And so he's building all these skills. He's doing what he loves. And he was just so happy. Whoops. So these are some of our other community partners. So you saw our little ice rink. This is First Line Training Center, which has 4 Olympic-sized ice rinks. And so these are some of our kids doing a group therapy. This is a single session here. So these are PT, OT, and speech sessions that you're seeing. They all kind of look the same. And this is one of our movement aides who's a hockey player.
Serious, just go for the ride. Just don't walk. Just go for the ride.
Nice.
What happened?
I think there's not enough room for.
Okay, so why don't you go pull him along? That's okay. Yeah. Just sit back, Connor. Sit back. Sit back.
So his dream.
Sit back. Slow.
So you can't tell because he's working so well, but this child has hemiplegia, and his dream is to be able to hold the hockey stick with both hands so that he can hit on both sides of his body. So they're working on all kinds of skills here, but he's really practicing like grabbing that stick, but he's doing it on the ice, full pads, which I tell you is a balance challenge. I've been in these sessions. And this is our wonderful movement coach who is a hockey player in college and came to really help us with our skill development on the ice. And here he is shooting.
Nice job. Ready? Yeah.
I'm going away.
Oh no.
I'm running.
We have to put handcuffs on her.
Someone's stealing the bullet.
I want to see a little bit.
So that's the same child then now using the skill to hit. And you could see, I don't know if you saw as he was shooting, he's got a wrist orthosis here that the OT team made for him. And it's his PT that you hear in the background, kind of coaching him on the balance stuff. And then Avi is the aide who is on the side. He's kind of one of our senior aides who helps us with a lot of our programming. This one doesn't want to go. I might have to stop it and pick it up. Sometimes the PowerPoints get stuck with the video. Will it go now? Nope. There he is. So now we've got the climbing gym. So this is one of the bouldering walls. A rappelling wall. And then this one does not have sound. So just, there's nothing wrong. Just somebody walked by and said some other child's name in the background as we were filming. So you can see, this is a child who, when I met him, could not step on the trampoline without falling down. So he has just been amazing over the last year. He has just done some really, really cool things. So just watching him like hold on and reposition and just really want to stay on that wall. And this is his OT session, but he also gets speech therapy at the gym. He like really hung in there. So one thing about working at MOCO across the board, all of our therapists become really movement specialists in a way that at Ithaca, I felt like I really did come out of school knowing a lot of these movement pieces, but I feel like that's not uniform across the board. And it's definitely not usual for speech therapists to come on and really have that movement piece. So we do a lot of in-house training, and a lot of part of my job as the therapeutic director now is I do push-ins for the entire staff. Sort of they list what kids they want help with, and I go and push in sessions, and we do a lot of training and a lot of cross-discipline support of each other. And it's, you end up being a movement specialist in a really different way, working in all these different settings. So this is just the gym. A lot of our teenagers think we're not really cool anymore over the gymnastics equipment, so we go across the street to the adult gym. I don't have any fun videos of the gym though, because they don't like us to film there. This is the Silver Stars Gymnastics Training Center.
Jump. Good. Feet together. Good. And down. And up. And down. Feet together. Okay.
These are
Stand
the
all way
parallel
up.
bars.
Put your feet together. Before you go down, put your feet together. And now go down. And now come up.
So he wants to swing on the bar. He wants to do like the pullover. So this is, and he actually can do one now. It's been a couple of years.
Don't jump.
And then forgive me the look of these. Our boss learned how to do boomerangs. But these are really fun because at the gymnastics gym, they have the different colored bed trampolines. I don't know if we have any gymnastics people on right now, but there's a difference between the black bed, yellow bed, white bed trampolines and how resistive they are and how much bounce you get. And so by partnering with the gymnastics gym, we can do the full Olympic sized black beds and then the white bed trampolines that do like the big giant tricks. So for some of our kids who have sensory needs, it's a great setting. And for our kids who are like ready to upgrade into something a little bit more powerful. We also partner with the Aquatic Center. We do all 3 therapies in the pool. And then we have a lot of partnerships with outdoor places. So we have lots and lots of outdoor therapy. I'm just going to kind of go through as we look at it. I love this. She's learning to skateboard, and one of my teenagers is a skateboarder who's now teaching her. So they work together every other week. In the creek. I wish I could find the picture of my kid that decided one day he was going to bike through the creek. We go kayaking in the summer. So this is one of our seasonal partnerships. We go kayaking at Black Hill Regional Park. Skiing, adaptive skiing. Lots of bike riding. And there's lots of messy fun. And that's what I've got. So I'm going to put this down so I can see more people. And I'm happy to talk about anything, whatever you guys want to see and hear. I tried to stay really good at the 25 minutes.
Awesome. Thank you so much, Taryn. Oh my goodness. That looks like the best thing ever.
It's a lot of fun.
Like, do you take fieldwork students?
We do. That's how we got Emily Grossi here. We've had her for, we just kept her for, I think, 4 years now.
Amazing. Well, now we just have some time. If anyone has any questions, feel free to come off mute or type in the chat, do whatever you'd like. And we'll just chat with Taryn.
Taryn, how do you know what to wear to work? I don't understand. You like, do you have a bag packed with like a swimsuit and rock climbing shoes? Like, you could tell I'm not a pediatric therapist, but I keep looking and thinking it's just amazing, and how flexible and adaptable you have to be across your day of going from, all of these different activities, and just how do you wrap your brain around that and prepare for it?
Yeah, no, that's a great one. So we schedule really carefully. It doesn't always go super well. But so what we do is with our community partner sites, we'll have specific days where we are at those sites. And so then when we have a child who wants to be in that activity, we schedule them for a time that's at those sites. So on Tuesdays, our therapists who are at Earth Trucks that day kind of head over at 1 o'clock. At 2 o'clock, the first kid comes, and we back to back our sessions all night there on Tuesdays. We just added another day on Wednesday because it's popular. Same thing with first line training. So we'd have 1 or 2 therapists depending on who wants services and what type of services are the most appropriate for who's going. We'll have them scheduled there for the day. And we do that usually in seasonal chunks. So like fall to winter, as that first semester of school, we'll usually have 1 schedule, and then we'll kind of reassess for the next semester as kids shift their schedules. We'll shift the therapist schedules to match up to what's going on. With some of the one-off sites, we'll either do those as special weekend trips or weekend days. Right now we have therapists that work 7 days a week, not one therapist working 7 days, but most of us either work Sunday through Thursday or Tuesday through Saturday. So we have somebody on all the time. And so we can do kind of those special weekend things or shift our hours to meet the kids where they are. And our partnerships shift based on where the interest is. So, but I do have climbing shoes in my locker. But in general, we wear MOCO shirts. I wear my MOCO shirt tonight. We have t-shirts for everybody for all different colors with our name on it, because when we are in the community, we feel like it's important for us to be recognizable to the families that are coming to meet us. And especially because our students, we usually have them for about a year. Sometimes we get lucky and they do their senior year with us and their gap year with us, so we get to keep them a little longer, but often we have them about a year and then they go off to school. So our aid population is always shifting. So we make sure everybody's in a shirt. So if it's somebody that the family doesn't recognize, they know that there's not some random person coming over. Yeah, MOCO is Montgomery County. I
was going to ask that too. Thanks, Jenna.
Yes.
I was like,
Montgomery
movement
County.
of children. I was trying
Yeah, no, Montgomery County. And if anybody speaks Spanish, the person who chose the green and the MOCO didn't know. So I don't know. So Montgomery County. And but we do have people who have to pack a bag to switch from the gym to the ice skating rink or something like that. We try to have as many supplies as we can at our sites if we can.
Thank you.
Hi, I have a question.
Okay.
First of all, the whole model is so incredible. I'm really excited to see that. There's nothing like that anywhere in where I live in Canada, in New Brunswick. I'm curious how the kids are referred and how, are all of them private payment, or how does that work?
Yeah, no, so we partner with insurance too.
Okay.
We're in network with Kaiser. We're preferred for TRICARE, and then everybody else, we do what you do to try and get as much coverage as we can. We're usually now out of network benefit, but we work with any insurance except right now we're not able to take government insurance yet. Medicaid, there's a whole bunch of hoops, especially in Maryland, we have to jump through to be able to do that. And then we also help families apply for grant funding if they need extra funding for copays and things like that. In Maryland, we have something called the LIS funding, which is low intensity support services. It's usually a couple $1,000s a year. There's Horizon Fund. So we'll have sessions at night or on Zoom and help families kind of fill out that paperwork to be able to access. But we do work with insurance. We have occasionally families that are private pay, but most of our families work through insurance.
Wow, that's amazing. And do a lot of kids get coverage for a year or that long, or is what's the average duration of treatment for kids?
So that really depends on so many factors. We do have kids who see us for multiple years or who go through phases of seeing us and being on break and coming back because they want to do something new or learn something new. But it really depends on insurance, sort of how often we have to fight for them to stay with us. So we do write a lot of progress notes. And we have, yeah, we write a lot of notes, but we work as hard as we can to keep them there. And we do a lot of work on sort of how we explain what we do to demonstrate the medical necessity and the sort of more impairment model. So there is a little bit of dissonance between what we sometimes have to write and for how we frame our work in writing versus how we frame our work when we're working. And both have truth in them. They're both true. We're working on these impairments. We're working on the skill development. We're working on community access. We're just doing it in a way that is very different than we see other places. But we do have to be really mindful about how we ask for those services.
I think that's a very common theme in any creative pediatric therapy.
Yes.
I do nature-based OT groups, so I know well about that.
Yeah, we don't write like played in the mud. but yeah, there's all those dynamic surfaces. You need all those transferred developmental transition skills. Yep.
Well,
yeah.
Sounds amazing.
I have a question. I missed the beginning,
Hey.
unfortunately. Hi. I had a conference today that ended at like 7:20. So you may have already gone over this, but what kind of goals do you address in that environment?
So really we can address that. Anything.
Later.
No, it's totally fine. So I didn't talk specifically about sort of like how we write our goals. So again, depending on who our audience is, we might word our goals really differently. But with the family, when we talk to the child or in the family about what their goals are, we try to talk about what is hard, what do you want to do, what do you want to achieve. We really try to use that top-down assessment style. And then we'll look at, okay, within this climbing, right? You really want to be able to climb. You really want to be able to join the climbing group and belay independently. All right, these are the things I'm seeing that you might need support with. These are the things that you might want to develop a skill for. Like, how do you want to approach that? When we write our goals for insurance justification, we're going to write the goal more about the skill, because then that's more understandable from the medical model perspective. So if I have a kid who wants to learn how to belay on the rock wall, what they need to do to that is they have to be able to tie a knot appropriately. They have to know the sequence for that. They have to be able to hold with both hands and pull, or have an adaptive device that allows them to do that motion. And so we'll write the goal about the bilateral coordination or the grasp strength or whatever it is that they're working on to be able to do that independently.
I love it. And just like one follow-up question, again, you may have gone over this already, but like how do people identify to come to get OT like at your place versus like a more traditional OT? Like, are doctors referring, or like how do people even know to come?
Yeah, so kind of a mix of both. So we do have doctors that will refer to us now specifically. We also have a little bit of a reputation in the community of working with kids who either other clinics have felt like they've aged out. So we get a lot of teenagers or who have been deemed like too difficult or to have too challenging behaviors to come to OT or to come to PT. We end up with them with us because we don't tend to encounter those issues. Or we have the space that really caters to their needs that were not being met at whatever space. So we have a couple of different referral sources. So some of our other community clinics will refer to us when they feel like we're the right place. We have some doctors that will refer to us. And then because we're networked with Kaiser, the way Kaiser works is they only will really work with one pediatric practice in however many miles. And in the DC area, Kristen, you know, right, 45 miles is not a reasonable radius for anybody, because that is not 45 minutes. That is not, so that would be like us driving to Manassas, which if you live in our area would be like me driving for 2 hours if I'm not going in traffic. So we are kind of the pediatric place that Kaiser sends people to. So about a third of our kids come directly from Kaiser and they don't really know what they're getting into, but it always ends well. And there's a lot of word of mouth in the community. So families will refer other families, or somebody will walk past us while we're all in the gym and be like, what is this? And then we'll end up there. I didn't even really talk about transitions. I had it on my notebook over here, but I didn't look over to it. But we also try not to keep our kids in therapy forever. unless they're really always wanting to learn new things. So for instance, we have somebody who's been climbing with us who learned how to belay, moved sort of from our little climbing wall to the Earth Treks gym. And now last week, our OT went with him to the youth like climbing meetup. I can't remember exactly what they call it, but it's like find a climbing partner meetup. I think it's called like a partner meet or a partner social or something, but you go and everyone that comes is a single climber who's looking for somebody to belay for them. And for anybody who's not a climbing person, the belayer is the person who holds the rope on the bottom while you are climbing, and then you switch places. So to be able to participate in that, you have to be belay certified and you have to be able to top rope climb. And you have to be able to enter that space comfortably. And so our OT went with the client to the meetup, helped him find a couple of different climbing partners that were a good match for him. And now next week he plans to go on his own. And so as soon as he's established in the climbing group, right, he doesn't have to come to OT anymore unless he's got another goal. So we'll kind of pass him over to that space. And we do the same thing with like gymnastics classes, right? If you're done with us, you've figured out the skills you need, and now you can go join your peers in class. And that's really where you want to be. Like that's where we want you to be too. So we're going to transition you over to class, and maybe we'll check in with you in 6 months and see how you're doing and make sure that you still have everything you need. And some of our kids want to stay with us forever and keep having new things they want to work on, but which is fine too.
I have a question. You touched on it a little bit earlier, but this is all absolutely so amazing too. And I'm just wondering, like, what really was like the inspiration behind developing a model like this? Like, what really sort of was the driving force behind it? And also, what has the process been like of setting up all these really amazing community partnerships? Did you find that the community was super open to it? And just sort of like walk us through that process a little bit. So kind of 2 questions in there, sorry.
Yeah, absolutely. So I came in near the beginning, but not directly at the beginning of MOCO. So a lot of our people that worked there in the beginning there were a couple therapists and a couple of our really more senior aides who came over. They had originally been working as a small group of therapists within a gymnastics gym. And so that was a really interesting model that they had made up. And it was just like, oh, gymnastics gym and therapy support here kind of in the space. But for lots of like space and like colleague reasons that I don't really know about, they decided to go ahead and open their own space to grow. And so then they opened our central gym. And what they did was try to model it off of things that are in the real world. So our director, owner, you know how we're like not very good at naming things. We're also not very good at naming ourselves. So she's always like, I don't know, call me whatever you want. So Andrea, she had really come to a place where she's like, I've been a PT forever, and I have never seen as much joy and as much progress as when I've seen these kids in the place that they chose to be doing the things that they wanted to do. And so then she sort of built out the team with the premise that, hey, this is what we do here. This is what our goal is. Like, join us if that's what you want to do. And so we've been really intentional about growing our team. So I think I was the 3rd therapist on the team. And we've kind of grown from there. And everyone who comes in, our interview process is you meet us like for a regular interview, but then you have to come and spend the day at the gym to make sure that we're the right place for you, because it is a really different feel. From an interpersonal standpoint, like we're all up in each other's sessions all the time, and the parents are always watching you and always in. It's just like a very like beautiful chaos when you're in the space. So for some people, that's not a good match for their own sensory systems or for their own processing styles, but also to make sure that, hey, this is where we are going to follow the child's autonomy. We are going to really embrace the functional piece of this. And that's really the goal. And some of the sessions are going to look more like traditional therapy because a child, that's where they are and that's what they're looking for. But that our overall goal is not to stay in the clinic, it's to move out to where they want to be. And so the community partnerships part, that's been a little bit different for every community partnership. So sometimes we've had sort of like an ask for forgiveness policy with like some of the national park spaces. But for things like Earth Treks and the pool and for Silver Stars, we've really just done that as a relationship, just like our model is relationship based. We've gone in and talked to the center and said, hey, this is what we're trying to do. I find that most people are pretty excited about this idea. And they're just worried about, okay, what's the liability? What's the nitty gritty of it? But they're usually pretty excited to do a trial with us and see how it goes. And I feel like once we do the trial, it's just really infectious, because you can see like the kids when they're on the ice or when they're on the wall or when they're even in the gym, right? Like they're just, everyone is so happy that I feel like it's just kind of infectious in the community. We've had a really, really lucky time like connecting with people who have just been really excited to be part of it. And there's always things to iron out. And Andrea is great at like talking through and negotiating and figuring out what works for everybody. But yeah, we've been really lucky to find places that are happy to have us.
Thank you.
Question, Taryn, this is fabulous. This is like so amazing to hear you talk about this, and that something this wonderful exists, and that we have ICOT alums leading this and part of it. My apologies if you talked about this already. I was just like dreaming of all the things happening that you're doing. But so our students learn about, right, the OT process, and you talked a little bit about goal writing and wondering like the assessment piece, like leading up to that. Do you do a lot of standardized assessments, non-standardized? Like what does that piece of the OT process look like?
Yeah, so it again kind of depends on where the child came to us from and sort of who their payer is, who we're sort of answering to. So we always start with what we call a pre-evaluation consult. So we like to meet the parents on Zoom or on the phone, or the family member who's going to be bringing the child in before the child's present, or if it's an old enough child to participate in that process, for us to meet them before we're in the gym. So we usually meet with them for about 30 minutes. I did one earlier today for a kid who I'm going to meet on Monday. And we get a chance to talk to them about like, why are you coming in? Like, what are you thinking about? For some parents, right, they're coming to us because we were the therapy practice that came up on Google. And so their focus is very much like, we need to work on handwriting, we need to work on this, so we need to work on that. And that's why we're coming. And so then we meet them where they are, right? We're going to do a more typical assessment. We're going to meet that kid, we're going to meet that family, and we're going to really talk to them about not just what are these skills that you've picked out, but sort of where do you see them fitting in, and where is you, if as a family, like what do you like to do? So we have a lot of families who will go to the climbing gym now together. We teach mom how to belay, and now they climb on Fridays as a family, right? So we try to tease out like, where is it that you want to be, and sort of lead them in that direction. And some of our families come to us because they're like, hey, I saw you at Earth Treks and my son wants to climb. And then we're like, good to go. It's like, yeah, let's stick them on the wall. Let's see how it's going. Like, tell me about how you're feeling up there. And we're going to just kind of make a checklist of, okay, what are the pieces that we need to work on here to get to climbing? And so it kind of depends on who's there. Now, the standardized assessment piece, we've been talking about this a lot as a practice right now, especially our OT team. We don't love them. Nobody really loves them. They don't tell us great information, but for certain payers, they're a really nice ticket to medical justification. So we still do use them. We use them judiciously, and we have a family letter that goes out with our evaluations that explains sort of our process and our treatment planning process, and how that doesn't really line up with the language that we're sending to their payer, and sort of why that is. And it's like, everything in this evaluation is accurate, but we're not allowed to put any of the strengths piece here. And here's the strengths piece in this letter. Like, this is what we're telling you that we're really focused on. This is the document that's going to help us justify getting you there. And so we do have to kind of make that difference in presentation of the information. And sometimes that does require the standardized assessment, even though for us, it's not the best data.
Thank you.
No problem.
Taryn, I wanted to ask a question, which might be a big question. I know we only have a couple minutes left, but if you could tell us just a little bit. So you talked in the beginning about, the philosophy on diversity and, neuroaffirming care. And I'm just wondering, especially perhaps for some of your older kiddos who have been in more traditional settings in school or therapy prior, and maybe experienced ABA or, some of these behavioral approaches, like, What's the response? You know, how does it go when they come to you and it's so different?
Yeah, so we encounter this a lot. All of the school systems in Montgomery County are PBIS. All of the programs that are available publicly are ABA based. And so we have a lot of kids who are maybe even coming to us and concurrently receiving those services. We, as internal to our practice, are very committed to having intrinsic motivation and autonomy focused care. And we try to meet the family where they are and help them along that journey. And some of our families come all the way along with us, and some of our families we get part way. And we try to balance that line between supporting the family and supporting that child and giving them a safe space that is free from those practices, and sort of helping to show how effective and how joyful that can be, without alienating the family and sort of losing that time for the child by stepping over that line. And so we try to really to walk a gentle line to invite families into that education process and into that journey without, we do really try to not chase anybody away, because we feel like at least if we have that time with the kid to let them explore that side of that autonomy focus and explore that identity piece, that we're doing good and doing harm reduction at that point. But yeah, that is a really, really, really tricky thing. We talk about it all the time as a group. Absolutely. I do find that for the kids, right, it can be a real adjustment period. So especially those sort of more traditional looking therapy sessions that we have, often those are with the kids who have come in who have had that really heavy background and who really haven't had a chance to develop the ideation around what they want to do and where they want to be. And so we do a lot of exploration, and we spend a lot of time building the relationship and really letting them settle into the fact that we're not going to tell them what to do. And that takes different amounts of times for different kids to really settle into trusting the fact that we're not going to force them into something.
Thanks for explaining that, Taryn.
Yeah.
I have a little question that kind of piggybacks Julie's, which is, I don't know if you've experienced this, but I also have like kind of a neurodiverse viewpoint, and I'm DIR floor time trained, where everything here is ABA. And I find that sometimes it's hard to toe the line of supporting these more like what you said in your little visual that you started, where we don't use any reward systems. Like, do you struggle sometimes as a team with how to explain to parents why, but also balance not being judgmental on what they've probably had their kid in for a decade? Like, I find that hugely challenging right now. Just curious if you guys,
it's very challenging. We try to embrace talk about what we do. Yeah. We don't talk about what other people do. Yep. Unless it's a family that we have a strong enough relationship with and that we've built that trust with, where we can have that conversation in a really open way. So we always frame it as, and we talk about this all the time too. So our little therapy staff is always having these like evidence discussions, practice discussions. And we did a whole series on like ableism this summer, where we really delved into that. And we talk about how do we say this in a way that's just really positive about our experience. And we focus on, so we'll say things like, we find here that we get the most engagement and the most communication when we really follow what's important to the child, because that's where they're going to have the most motivation to speak. Or we'll say, the evidence is really moving in a direction that shows us that we should be really focused on this autonomy piece, because that's what's going to lead to effective self-advocacy. So we really focus on that here. And so we just present little pieces of it that way, whatever is applicable to that child. We do talk a lot about self-advocacy and safety, and sort of not embracing sort of compliance to any adult at all times because of safety issues. And so we will have that explicit conversation that, hey, if he tells me no, or if he moves away, I'm not comfortable continuing. And even if the parent is stepping in telling you, oh, just X, Y, Z, right? It's like, oh, we don't do that here because we really want to set up an effective body autonomy because the rates of abuse are so high. We want to be really careful about never crossing that line. So we have like sort of back pocket phrases that we use, but there are definitely conversations where you just have to hold space for that parent and give them the space to explore it on their own and sort of slowly roll out resources that will hopefully help them in the right direction.
Awesome. Thank you so much.
Mm-hmm. It's a hard one. That's our hardest one, I think.
I think we have hit that time, and Taryn, we don't want to take any more of your time that you've already given us. This presentation was just amazing. I know I'm going to be thinking about it for so long. So amazing.
Come and visit, anybody.
Thank you so much for coming. And for everyone on the Zoom, thank you so much for coming and listening and being a part of our wonderful speaker series. So since it is April and it is OT month, we do have one more speaker series event this month. Next week on Thursday, April 28th, we have Larissa Pauly coming, and she will be speaking on non-clinical pathways for rehab professionals. So very exciting stuff. We hope to see you all there again. But yeah, Taryn, thank you so much. This was
Of course.
And I hope everyone has a lovely night.
Thank you so much. Bye, guys.
And I'm going to just chime in and say like how thrilled I am to see the turnout tonight. Everybody from prospective students who haven't even joined IC yet to alums who have been out for 10 plus years and kind of everything in between. So thank you. This was the vision and we're so happy to have all of you. Thank you, Taryn, for all your work.
Absolutely.
Hi, everybody. Happy OT month.